Hello, it's Fancy Cheapskates. We are not medical professionals. We're simply providing our experience with cruising after dental work.
It's Fancy Cheapskate with the person who benefits from my cheapness, Mr. Cheapskate. And Mr. Cheapskate had a bad toothache. And so Mr. Cheapskate had Mrs. Cheapskate call in and set up an appointment for him. And long story short, 4 days before this trip, he had 2 teeth removed. It was limiting. It has affected the cruise. So Royal has a rock climbing wall on this particular ship, Independence of the Seas, and the sky pad and huge water slides. We haven't done any of those yet. But how come we haven't done them the first few days?
Well, probably because I was knocked out from all the pain medication.
Okay, so Mr. Cheapskate.
And trying to, not bleed.
Exactly. Mr. Cheapskate has bleeding gums from his dental extractions. And so he's trying really hard not to get dry socket. He's trying really hard for his blood clots not to fall out. And so that's one of the reasons why he has not done the rock climbing wall and the sky pad and the flow rider yet. He was concerned that those were going to fall out. And today is one of the first days where he hasn't had any pain, period. However, the first 2 nights, he had blood all over the pillowcases because his gums were bleeding.
Long story short, folks, if your teeth hurt really, really bad, chew on cinnamon gum and jam it up around whatever teeth are hurting, and that'll help alleviate the pain. Take some Excedrin migraine and wait till after your cruise, then get the surgery done.
He's been on
Go on your
antibiotics
cruise first, seriously. Suck it up, guys. Suck it up.
He's been on antibiotics 4 times a day. He's been packing cinnamon gum into wherever he needs to pack it into to try to minimize the bleeding. The first 3 days of our cruise, we woke up to bloody sheets and bloody pillowcases. So we've tipped our room steward extra. And some of the things that I would like to do with him, hopefully we'll be able to do today. And this is day 4. So the first 3 days where we could have been enjoying the flow rider every day together, and cheering each other on, we haven't. So yes, it has been limiting. There's so much on the ship that he can still do despite bleeding gums that he's really enjoyed himself. He's really enjoyed the Independence of the Seas, but some of those just more physically demanding activities that we as a couple really enjoy doing. We love going up and down water slides on cruises. We're like a couple of kids when it comes to that. We just haven't done yet. And don't get me wrong, I can still do those things. I would love to do the flow rider and everything. It's just different when you get to do that with your spouse. And so hopefully we'll be able to do that soon after. What are some of the things that you would like to eat on board that you haven't been able to?
Steak.
Bacon.
Bacon. Yeah. Really like to have some bacon. Really
And
not a good idea right now. Oh, and chips. Can't have chips. Yeah.
basically his food has to be very soft and very tender. So anything crispy and crunchy that he would normally eat, he can't right now. Which is kind of sad because when you're on a cruise, there's all kinds of foods that you want to try. There's such a huge variety.
It is limiting because you're like, I want to try that, but I don't know if it's going to be safe to eat because you're afraid like you might bite into something and then it's just like, oh no, now I got blood dripping out of my mouth.
Or sometimes if I have something really, really good, I'm like, babe, try this. And I feed him. I've been feeding him our whole marriage. and now I'm just like, oh, he can't have that. So it's different, but there's still such a huge variety on board that he can still have foods, just not everything that he would like to have. So he really didn't want to be on camera, but I was really hoping that this information might be useful to someone who might need a dental procedure and it's close to cruise time. If it's close enough to where you can still wiggle around with the dates, you might want to put either the dental procedure off a little bit or just move the cruise around so that you really can enjoy the cruise without antibiotics, pain medication, bleeding gums, potential risk of dry socket, not being able to have the foods that you would prefer to have, or having to avoid fun activities that you might really want to do that might potentially knock out that blood clot and cause dry socket.
What you need to worry about is just getting past the first 7 days. So if either schedule the work for at least 7 days before you leave for the cruise, or do the work after you come back.
So thank you so much, Mr. Cheapskate, for sharing this information with
Until then,
others.
some Excedrin migraine and some cinnamon chewing gum will hold you over if you choose to do it after you come back.
But by all means, take care of your teeth, folks. Bye.